to the timesofIndia.com digital conclave on National Doctors' Day, a tribute to the torchbearers of our health. I'm Dr. Ananya Avasthi, your moderator for this session. As a public health practitioner with Masters in Global Health from Harvard University, I bring a background in policy consulting and currently lead Anuvad Solutions, an organization dedicated to translating science for informed policy action on health and nutrition. Today, we gather to shed light on the significance of this conclave. Talking about some context to this conclave, medicines cure diseases, but doctors cure patients. These words by renowned psychologist Carl Jung emphasize the invaluable contribution of doctors to humanity. They are indeed the pillars of a country's healthcare system, often sacrificing their own well-being to serve others. On the occasion of National Doctors' Day, we come to recognize and celebrate these health warriors. Now, talking about the specific session, the particular topic for this session is doctor-patient relationship in the age of internet and misinformation. Now, given that this is so relevant in today's digital era where we face challenges of an overload of unverified and conflicting information available on the internet, then there's abundance of misleading content which has also created negative awareness amongst masses, often straining the relationship between patients and doctors. In this webinar, we aim to address this issue, explore strategies to rebuild trust in the doctor-patient relationship. And to do that, we will delve into the importance of reliable sources of information, empowering patients to make informed decisions, and fostering effective communication with healthcare providers. Now, before we get started with our amazing panel, let me quickly introduce you to the senior doctors who have joined us for this webinar. First up, we have Dr. Girish Tyagi. He is the past president of Delhi Medical Association, also past president of the Indian Medical Association, Delhi North Zone, and past president UCMS alumni. He has been awarded Lifetime Achievement Award by the Delhi Medical Association, also the recipient of Doctor of the Year Award by IMA Headquarter Global Outreach Healthcare Award 2020. He's also on the board of the School of Health Sciences, IGNOU, New Delhi. Then we have with us Dr. HS Chabra, who is the chairperson of Spine 2023 India, the president of the Spinal Cord Society, and the president of the Spine Society Delhi chapter. He's also chairman, Spine Wellness and Care Foundation, is the editor-in-chief Journal of Clinical Orthopedics and Trauma, as well as vice president of Association of National Board Accredited Institutions and executive member, Asian Spinal Cord Network. He's been immediate past president of the International Spinal Cord Society and past president Association of Spine Surgeons of India. He's received many awards, and he has also been acknowledged for immense contribution to the realm of medicine and to growth of various institutions, particularly promoting excellence in spine and orthopedics. We have with us Dr. Sanjeev Patel. He is the fellow of the Prince of Wales Children's Hospital and Prince Henry Hospital, Sydney, Australia. A doctorate in pediatric nephrology, National American University, Delaware. He is a gold medalist from Bombay University, Sir Dorab Tata Merit Scholar. He's also previously been the CEO of Batra Hospitals, CEO and Dean of Radiant Life Care, and Vice Chairperson of Manipal Hospitals, Delhi. He was awarded the DMA Vashisht Chikitsa Ratan Award of Excellence, Lifetime Achievement Award from IMA, and he's also the recipient of Times Award for Medical Achievement and also Global Top 100 Innovator Award and many such more. Finally, we have with us Dr. Ashok Seth, the chairman of the Fortis Escorts Heart Institute and Fortis Healthcare Medical Council. He's the adjunct professor of cardiology of JN Medical College, Aligarh Muslim University, and National Board of Examination, also president of Asian Pacific Society of Interventional Cardiology. Sir is past president Cardiological Society of India and past vice president Asia Pacific Society of Cardiology. Dr. Seth has received the national honor of Padma Shri, Padma Bhushan, BC Roy Award, eminent medical person, honored by doctorate from almost 6 prestigious universities in the country, and also listed as the most glorious alumni of the JN Medical College. Thank you, doctors, for taking out time from your busy schedules. Before we get started, a big thanks that you've taken out time to attend this digital conclave where we hope to spread awareness about doctor-patient relationship in the digital era. So my first question to you is, Dr. Ashok Seth ji, how has the internet and abundance of information impacted the doctor-patient relationship? starting with a basic question so that our viewers understand what is really the focus of this session. Over
So
to
let
you,
me
sir.
just start off by saying that it's a very important discussion that we're doing today. This is an evolution, clearly, of the doctor-patient relationship in the right direction. And I want to emphasize right in the beginning. We are sometimes faced with these questions saying, is it eroding doctor-patient relationship? And absolutely no. I think doctor-patient relationship has actually been strengthened in the internet era. We all look at internet, and let me just give you a few examples of how this strengthens it. We've always believed, and as science and medicine has evolved, it's gone to very, very complex techniques. Truly, some of those techniques are for serious illnesses, and the plethora of progress has been such that anyone can be confused by what seemed to be a treatment option of 20 years ago gets outdated today. And we very well know that in our own experiences. Patient needs to be informed, and he needs to be a part of the decision-making process very clearly. In the last 15 to 20 years, we've realized that. And when we realize that, the best way for the patient to become a part of this decision-making process is to inform him and empower him with information. Now, we know that, for example, there's a procedure called transcatheotic valve implantation, which is a complex procedure. And I have to advise a patient that if I was to take him through the whole steps of that procedure, it becomes extremely complex for him to understand in the first instance, and I would have to spend 30 minutes or 40 minutes explaining just the procedure to him. What is my action towards him? I encourage him to go to the net, read up about TAVI, put down the questions that he wants to know, and then come back the next day and then sit with me so that I can answer his questions. In fact, I often tell my patients, can you look up the net, and then we'd like to have another discussion whereby I can answer your question. It strengthens relationship, it creates trust, and it is the right way. Not that the patients have to accept that, it is right way for us doctors to accept this change, because patients are really going to the internet, want to have information, and be a part of the decision-making process. And if they are a part of decision-making process, they are going to manage themselves better. Even for illnesses which are preventive measures, they're going to handle it better. For treatment options, they're going to be part of the decision-making process. And I think we need to empower our patients and correct ourselves as doctors, rather than be subjected to insecurity about patients going to the internet for information. However, that information has to be correct, and we have to restore our confidence in answering the right questions for the patients after they've been to the internet.
Right. Thank you. Talking about the challenges, you of course spoke about how this is a natural movement, the way doctor-patient relationship is evolving. But coming to Dr. Tyagi, what are some of the common challenges that doctors face in addressing misinformation that may be spreading online? And we especially saw that during the COVID era. And what's your response to it?
Yeah, because nowadays the internet provides a vast platform for dissemination of information that can be taken as misinformation. And they are just getting misinformed about the diseases, about the nature, about the illness, about that future part of action of that matter. And they are coming with that. It is difficult for doctors to monitor and counter every false information, because it is a vast area on the internet, and it is difficult to address all those issues, because doctors of course have a positive time when going through the net, and so it is very difficult for that matter. And as far as this misinformation, it is going at a very rapid speed, and it is going on viral at the same time. So it will be very difficult for our doctors to check all the time what is the misinformation going on in the net and the portal, and it is not viral. And of course the time constraint is always there, because the doctors have to, in the same time, as Dr. Ashok said, saying that he's spending so much of time, but most of the doctors are not able to spend so much of time with the patient because of the positive time, and so just to have the informed in the right way, and of course simultaneously they have to get the clarification about that misinformation which the patients are having for that matter. Then there is a issue in that whatever the news in the misinformation, there is a technical, because the medical information is with the technical jargon. There are various aspects which the patient don't understand, and of course the language part is there. Then there are legal and ethical issues are also there, because once they are going in that on the portal or the media for clarification, then they, of course there the confidentiality can be broken. Then autonomy of the patient is also there, which is a part of the ethics part of the, which have been told to all the doctors about that we have the autonomy, beneficence and non-beneficence, confidentiality has to be maintained for that matter. Then of course the pressure to respond quickly, because once the misinformation going on the media, there is a pressure to respond quickly, and of course because of the positive time, there is always a challenge for that matter. And sometimes it is also a difficulty in identify the misinformation, because we are not able to identify what are the misinformation going on the media. And then lack of training, because our doctors are not trained for that matter, because it is not a part of the curriculum. It is just suddenly for the past few years or so, this kind of social media interaction, Twitter and Facebook, and these are going on. And some of the doctors are trained for that matter. They have employed their staff for dealing with these kind of misinformation, but most of the doctors don't have such kind of facilities, and they are not been trained, so they are not able to justify in tackling that information for that matter.
Right. We spoke about misinformation, but say Dr. Chhabra, it's not so much, say if the case is not that of misinformation, but the patient is presenting some sort of conflicting information. Say they've read about some treatment online. Everybody does that. As soon as you're diagnosed with something, all of us go back and read up, what could be a potential solution. And if the patient is coming and saying, Doctor, ye wali dawai ya ye wala treatment, and then how do you deal with such a situation?
I totally agree with you that it may not always be a misinformation. The patient may have gathered information from other sources which may be conflicted. Sometimes trying to tackle this can be challenging, but it's actually an ethical obligation on us physicians to try to foster a type of a therapeutic alliance with our patients. Right? So we have to tackle this situation effectively. And one of the very important aspects which come into play are effective communication and listening skills. As Dr. Tyagi said, very often we are not trained for this, but this has to be part of our curriculum, because this is so very important in building trust and rapport with our patients and establishing a good doctor-patient relationship. We should learn to be active listeners, and this is very important. Then we should try to assess the source of information of the patient, try to find out whether it has been from other doctors or whether it has been through the internet, and then try to tackle that accordingly. We should try to build up trust also by acknowledging to the patient that there can always be benefits of trying to gain information from a reliable source. It helps in better understanding, it helps in more compliance, etc. But we should also clarify that information from other sources should be considered on merits and can't be blindly trusted always, right? So we should emphasize that there are reliable sources, there are unreliable sources, and then accordingly we have to we should be able to assess the source of information intelligently and then frame our own opinion in this regard. So of course, if there are any misconceptions of the patients, we should be able to address that. We should be able to explain to them why we think they are misconceptions and what is actually the evidence base in this regard. So everything should be done to have an informed patient and have a shared decision making, right? Things have changed now. Patients want to rely more on information and want to be involved in the decision making. And of course, it is very very important to be open to dialogue, not try to rush things through in such a situation. And unless the patient feels engaged, they will not comply with you. Right? And you should always say that, okay, like the parting words could be, if you have any other apprehensions or come across any other thoughts or information, please feel free to get back to me. Our ongoing support is very important. So to summarize, a patient perspective is very important and should be acknowledged, but it is our duty to be able to guide them to evidence-based practices and proper sources of information.
Right. And to the last point you said, I really like the way you said that, before the patient is leaving the clinical setting, you'd say that if you come across any other information, come back to us. So my next question is actually sort of on the same lines. Dr. Bagai, how can doctors ensure that patients feel comfortable sharing the information that they have read up online? Because there may be a case that patients may feel a little hitch in, accepting and acknowledging that there's something else going on in their mind based on what they've read online, and they may not be very forthcoming sharing it with the doctor. So how does a doctor make them feel comfortable, and especially say in a government setting where there are so many, what a patient load that there is? So what is your message to doctors who may be watching this online, given your years of experience?
Good afternoon. So I think when you talk in terms of a doctor-patient relationship, it's all about trust, and trust is always built. It is earned. It is never commanded. You cannot ask for it. The important point here is that the overall social media and internet setting is a part and parcel which we have to accept. Point of view and a doctor's point of view. All the information which we talk for information need not information. I think net is an important source of linking with the recent advances. Now, it's not just a mere name. The patient is a living soul. To address his needs or her needs, visualize. Spent with the patient is extremely important. Minutes after the medical is over to resolve the queries. Be rest that they would have searched everything about their own. I presume that the disease is before they come into your clinic or your consulting room. So I think it's important to understand that the patient is well informed. As a medical fraternity is, give them guidelines of base medicine. And episodes or a personal preference does not hold good in today's world. Let them understand that whatever can be validated, we have to make them. Universities are bad universities. They should not be trusted. Google from peer review in well-established journals is acceptable. There is a search engines in which patients, but the important is that we need to address from an individualized point of view. Group discussions in the hospital are great value. So I think a little bit of time in a meeting room where privacy is maintained with family after you've seen the child or elderly is important. Or 3 other specialists, especially in intensive care, critical care is important. Explain their point of view together as a combined meeting. Otherwise, the source of information they from different quarters are different. The important thing here also is, from our point of view, is extremely honest. We need to tell the patients what the clinical condition is, the possible complications in a procedure or a surgery, what the long-term risk is. When they come back to us, the compliance becomes an issue, especially, let's say, for example, in children in congenital heart disease or in kidney disorders, in which you have to give immunosuppressants for months together, years together. Ongoing dialogue with them establishes and maintains a rapport. Writing down their queries. In fact, in my prescriptions, I write down the thoughts which the patient has shared. So it becomes a reminder for me as to what we need to address ongoing. Very often, patients' questions may sound extremely stupid and repetitive, but that's a query in their mind. There's a syndrome which is being floating around in the internet. It's called as an idiot syndrome. It's called as an internet-derived information obstructing treatment. Now, those variety of, although it's rare, are people who will get stuck and dogmatically be averse to an idea of what they hold need not be true. So medicine is individualized, it's personal, it's organ specific. So 15 years of learning medicine in graduation, post-graduation and fellowships and 20, 30 years of practice cannot be equivalent to a 2-minute reading on the internet. So internet is a double-edged sword. We should use it for its good, but be careful of its harm. Over to you.
Thank you. Thank you for introducing us to this syndrome. And as you rightly said, 2 minutes of cursory reading over the internet, and I would like to reiterate it, given a lot of viewers who may not be doctors or specialists who may be watching this webinar, that definitely the internet is here to stay, but 2 minutes of cursory reading about a disease is no comparison to the years of experience that doctors bring to the table. Dr. Seth, Dr. Bagai spoke about sources of information. What is your message to potential patients and the patients that you see, and even doctors? What could be some of the strategies that doctors could deploy in terms of, tips that they could share with their patients on distinguishing what would be a trusted source of information vis-a-vis, an area where they're more likely to be misinformed or disinformed?
Sure. I think let me just address a couple of other points before we get to that. And my couple of other points are the message about searching the net for the right information. One of my close relatives needed a surgery. It wasn't my specialty. It was an eye surgery. And I actually went to the net and looked at every aspect of how that surgery had to be done. I even looked at the type of lenses available for that cataract surgery, which were the latest generation of lenses. What had each lens to offer? It wasn't that I was looking for misinformation. I was looking to ask the right questions when I went to the ophthalmologist for my close relative, so as not to waste his time and yet to have my thoughts very clear. Finally, the trust has to lie on the doctor who I went to. I asked him those questions about 3 different types of lenses. I said, why not this lens, which I thought seemed to fit into my mind as the best lens? And he explained to me the reasons why what I had read cannot be taken as a holy grail, and that he as an experience knew the finer deficiencies of that lenses, which I had not read about. Finally, he was the one to operate on my relative, and therefore I actually trusted him because he's going to handle the procedure. The net is not going to handle the procedure. He's actually going to handle any complications which happen, and the net is not going to do that. And finally, he's going to make my relative better, and the net's not going to do that. So yes, how we use the net is extremely important, and we have to therefore define it for our patients. But it's also been seen, doctors who are resistant when a patient faces them with an information of the net and tend to therefore be abrupt, even tell the patient, why are you talking about this? Do you think that net has all the information? Isn't my experience more? Are less likely to find the confidence and trust of the patient and will have aversion. So therefore, it is our responsibility to make sure not just that we answer them and openly tell the patient to come up with the information where he says, I looked at the net. He should not be diffident of saying that I looked at the net. We should encourage that factor, but we have to then emphasize, is it information, is it information? So when I tell my patients proactively to go to the net and look it up, I tell them a few things how to find that information. I say, look at, firstly, the source of information. It should not be advertorial. It should not be sponsored. Secondly, look at the sources which come from research trials. Where does that source come from? Is it part of a research study? Is it part of a peer-reviewed research study? Or is it an individual statement? An individual statement can be correct from known authorities, but can also be incorrect if it comes from a biased person. And therefore, a known authority is less likely to be biased because he's peer reviewed whenever he stands up. Thirdly, you also need to look at whether it comes from an institution of standing. A lot of information which is correct. Say example, how is a transcatheteric valve without surgery performed? A very complex procedure, but there are details of how the procedure is done, what the patient has to expect, what the patient will go through, how will he go out of the hospital, how's the valve put in. All those coming from good institutions will actually inform the patient better about the procedure he's going to have and the choices he will need to make. So look at the source of information. Finally, and very importantly, it has to be evidence-based. If it comes from societies, professional societies, if it comes as guidelines, then it's well understood that those are the guidelines which generally do get followed but can be modified by experience of individual. Finally, the trust issue has to be a part of compassion, care, ethics, which the doctor has to inculcate into the patient. It's a compassion. I can't just sit there and say, my 5 minutes is up. You're asking too many questions which arose to you. If you got so much knowledge about the net, go and get yourself treated. What a wrong way for us. In fact, if I say about deterioration of patient-doctor relationship in the net era, I think partially the doctors are responsible for being averse to a patient who comes up and says that I read this on the net. I think the doctor should say, that is so good. Now, what are the things that you want to clarify? And let me help you to clarify misinformation from the right information. I would then encourage him to go back to the net to look at the right information so that I can correct his misinformation, not just by my saying so, but he will find even on the net information versus misinformation if I've been able to differentiate it. So I think we have been wrong over the last as doctors. In fact, I would rather encourage the patient to come to me with all those questions, saying openly that he's read it from the net, rather than quizzing me. He's read it on the net, and yet he quizzes me, and I'm being diffident, and he's lost his trust, and he doesn't want to open up to me. The third, fourth information is, I always tell them, fifth way I tell them, never go by hearsay. Never go by what another patient told you. Never go by what my relatives said. Go to the net. Again, go back to the net and start understanding. So overall, misinformation has to be differentiated. There are ways on the net which I have described to differentiate misinformation from the right information, but we also have to guide them to differentiate between the two every time they sit on us. And finally, it's also been seen that repeated seeing the patient, you may not want to have enough time to spend, and many of us do not have enough time to spend. But we can never be angry with the patient, because with the patient, we've also got to believe that this is our relative sitting in front of me. Would I get angry with my own relative if he was asking me 4 different questions? It is his natural need. And if we address that need, even in the shortest possible time, we address that very important issue. I'll just give you an example, and it won't take much more time. Others' time is valuable. A patient asked me at 12 o'clock at night, when after I had done an angioplasty and put in a stent, whether I should have put in a different stent and why should I put in this stent. Now, I had at 12:30 at night, after finishing 8 angioplasties, I had 2 things to say. I could have said, is this what you want to talk to me at 12:30 at night when I'm finished my huge list? I've got to go home. Now it's been put. Do you think I would put in a bad stent? Now I could be angry to him, or I could have said, I've put in this stent. This, I believe, is a stent which I would have put into my father or myself. You won't know much about it. You may have heard of it, but I put this into my father. And you don't worry, I'm responsible for his well-being, and I'll make sure that he never has any problem with this stent. I'm there for you always. It took the same number of words. But he actually now had the confidence saying, I don't even care which stent got put in. Doctor said at 12:30, he's going to be responsible. I could have said exactly the 3 different sentences and saying, Can't you talk this tomorrow? Is this the time you got to talk to me? And believe you me, his trust would have gone. Had the patient had a problem, he would have said, this guy put it in the wrong step. So therefore, I think it's up to us. Yes, there will always be that small group who will rely on misinformation. They rely on misinformation because it suits them. They don't rely on any other reason. It suits them to think that way. They find a literature which actually supports their own thought process. For example, a patient may not want a surgery, and he then looks for every reason not to have a surgery, even though he's got life-threatening disease process. And he wants to have a surgery, and then he finds somewhere some blatant misinformation being propagated saying you can be treated by X therapy or Y therapy without having a surgery. And therefore, he loves that, and he will take that misinformation. Now, this is our responsibility, how we can take that misinformation away. And certainly, certain issues have to be corrected for blatant misinformation which exists on the net.
Right. Thank you. No, I think sharing these examples always, drives home the point. And I think these examples are always very necessary to understand how, such ethics or such strategies actually play out in real life. My next question to you, Dr. Tyagi, and I think we did touch upon the term shared decision making. So in the era of patient empowerment, tell us more about what do you think about shared decision making and whether or not doctors should encourage patients to actively participate in the healthcare decision making process, and like what are those boundaries and to what extent is that helpful?
Yeah, that's a very nice question, Dr. Ananya. As all the panelists, esteemed panelists also say, commenting on that communication and the shared decision making, because at Delhi Medical Council, because we got to take the complaints of the patients, relatives, government from the central government, and most of the complaints are because of poorly communicating or non-communicating, because we doctors were not told about that communication part. We were taught, so it was not part of the curriculum also. So after Dr. Ashok Seth is here, we spent 10 years with Delhi Medical Council, and then we wrote to the Medical Council of India Health. Now the communication is the part of the curriculum also. So once it is part of the curriculum, it should be effective communication. Effective communication means let us give chance to the patient and the relatives to ask questions. Let that to open-ended questions should be there, and it should be two-way communication, because gone are the days around 25 years back. Then doctors think themselves that if the patient is asking question or the relative asking question, they are challenging his authority. Now it is not there like that, because the patients are aware when they are coming to the doctors after going to the internet or through the various media or through the relatives. Then it should be two-way communication, and doctors should be in the habit of active listening. Our Dr. Chhabra has also told about that. We should be. Now, what about the shared decision making? Because we received the complaints because the patient and the relatives are not being involved in the decision making part, and here comes the informed consent. Once the patient is being examined by a doctor, he should be told what are the options available to the patient about that treatment part. Then what are the complications will be there if this treatment is being followed. Then what are the alternatives available to the patient if they are not followed this treatment. Then what are the benefits of this treatment and what are the counterindications if it don't. So these kind of information should be shared with the patient, and they should be part of the decision making. If the patient requires a surgery, he should be told that such and such surgery will be there, it will take such and such time, these kind of complication can be there. If you don't follow these kind of precautions you have to follow, and these kind of alternatives are also available there. And so these kind of things, shared decision making should be there, because in our presentation, because Delhi Medical Council is also wearing our doctor's flag, and we have A, B, C, D, E. A stands for availability of the doctor is there, timely availability of there. B is the behavior is also important, and C is the most important part, that is communication and consent. D which you told, that decision making. You should involve the patient and the relative in the decision making. And E stands for empathy. That if we are empathetic towards the patient, likelihood they will be satisfied with your treatment part. And we at Delhi and all over India, we have witnessing that most of the time the patients are not satisfied, and ultimately there is a violence against the doctor. There is a because of these non-medical issues like communication, empathy, behavior. You're not involving the patient in the decision making. Because of that, this is a assault and violence against the doctors and so on. So decision making is very, very important, and we should respect their autonomy, because ultimately it's the patient who has to decide what the treatment he has to follow. And if they are not giving the consent, your doctor duty is that they should inform the patient about that all the things. If the patient doesn't agree, then the doctor cannot touch the patient, they cannot operate the patient if the patient is not satisfied with that part.
Right. Thank you. I think this ABCD, it's a good acronym and a good way and a good reminder for how important communication is in the entire doctor-patient relationship. My next question to you, Dr. Bagai. In India or globally, are there any initiatives or collaborations that you would like to highlight? Any collaborations between healthcare professionals and online platforms to combat misinformation and promote accurate health information? And is there an Indian example also? And if there isn't, what should it be like? And what do you think would be helpful in the Indian context?
Yeah, so there is information in the available globally. People tend to get it from different places. They get it in bits and pieces. The fear really from a medical point of view is that the information which they read need not be authentic. The information which they then assimilate and understand may not be complete, and it may not actually apply completely to that index patient. There is no classical example more than what this divide has shown is during this pandemic. If you just go through the first 1 year of the articles which came out, and that too through reputed journals, I may add, 36% of them were retracted after they were called out as being inaccurate, or the methodology was wrong, or the data interpretation was fabricated to make an endpoint reach which was decided. So we need to be careful as medical professionals also, as what we read should be from authentic information. The doctors also should be trained how to read and critically analyze data. I think a lot of doctors lack that kind of versatility. It's important in today's time. Just look at the series of mishaps which even organizations of world standard like WHO have committed. And this information was then rampant all over the net. Masks are not important. COVID as SARS-CoV-2 is not airborne. Super spreader events are not that dangerous. COVID parties were being organized to spread COVID so that people get natural infection. COVID is mild. Just look at the misinformation. Children do not get COVID. Children are spared from COVID. COVID does not reoccur. All of the above what I have mentioned are 100% fake and misinformation. So I think the medical associations in the states, the national bodies, and indeed the government should set up links between the medical professionals and the people who actually publish this, not only in print but in internet, so that they get the exact link between us, the patients, and the publisher. What is once published is widely then read. Even if it is retracted, the damage very often is done. The other important point is that I was reading a very, very interesting article just this morning, which was published in JAMA, Journal of American Medical Association. A meta-analysis was done of more than 1,059 articles. And this misinformation, which was being called out by the medical professionals, 66% of them had social, physical, or other forms of harassment for calling that out. So I think we need to be careful in today's world. The amount of trolls which people have got, the amount of anti-science lobby, anti-vaccine lobby which operates. So there are a lot of hidden agendas. I think we as medical professionals should steer well above the board, be very clear in our communication, be honest in our communication. The key is to spend time, link, if you see any misinformation, link with the medical associations or directly with the publisher or the author and inform them that this is what your thoughts. I think Twitter is a great media in which international celebrated figures can come together and share their thoughts, share their experiences, give their views on certain articles or certain methodologies, certain processes, certain treatment. But I think we need to be honest with the people. We need to be clear with the communication. We need to spend time. I keep saying this, spend a couple of minutes after consultation with the family members. Very often call a group of family members, especially in a hospital setting. If you're just explaining to the wife or to the son or to the child, it need not be sufficient. So call them, otherwise you will be approached again after a couple of hours with the repetitive questions. And jot them down and be open. Over to you.
And I'll come back to you on the question of social media and get more insights on that. But Dr. Chhabra, Dr. Bagai shared so many examples of misleading information, which is almost dangerous, right? If it is taken on face value. So my question really to you is, what tools or approaches can doctors utilize to educate patients about the risks of relying on such kind of unverified misinformation or disinformation? How do you explain to patients that this is, that this is dangerous? Let me say that.
I think, as we discussed before, one of the very essential tenets of trying to do this is through good communication skills and building up a good trust and rapport with the patient. So Dr. Ashok Seth also pointed out that you have to rely on evidence-based practices, but then there are various levels of evidence, and this needs to be clearly brought out to the patients, right? There's a difference between an anecdotal experience which may be there, or testimonials which you find on the websites, and well-conducted studies, and especially those which have been peer-reviewed and published in the literature. So that should clearly be explained to them that a good level of evidence is one which is a level 1 evidence or a level 2 evidence which is well conducted and published. So also means we should bring out to them that on the internet there are all kinds of information. There can be promises of miraculous cure, like there is for stem cell treatment in spinal cord injuries or other things. One should be able to assess intelligently the information which is there, what is the source, what is the methodology they have used, and one should look at reliable sources of information only, so that one should be trapped into unethical activities which are also prevalent on the internet now. So this needs to be clearly brought out to them, and they could be explained risks and consequences, like delayed or inappropriate treatment if you rely on unreliable sources which are there. You can share examples to the patient of patients with them on where they have gone awry, and that has complicated matters since they did not rely on authoritative sources of information. And as was also pointed out before, right, the importance of expertise and experience should be clearly brought out, right? One goes through all that training in the medical school, then goes through the specialization and the experience that counts, and just not relying on that information which is there in the form of guidelines in reliable sources or the doctor that you're talking to, and just on hearsay or on some misinformation which may be there on internet. You should be able to assess that, and you have to follow that accordingly. So again, I would say that we should Also tell them, have a regular follow-up and reinforce this with them. That is very important. Tell them that, okay, if you need any further information on what are the reliable sources, I have shared some with you, but then you should always, you could always get back to me. And this all is very important in a shared decision making where patients are directed towards proper reliable sources of information, as Dr. Ashok Seth also pointed out, right? Associations have their position statements. Indian Council of Medical Research also has information on that. Similarly, there are guidelines which have been brought out after a lot of deliberation based on evidence, and this should be relied upon rather than any information which anybody could put up on the website. It is important to communicate this to the patient.
Yes, as you said, and as another panelist said, it's the doctor and not the internet which is going to end up treating you. So on that note, we would like to conclude the session. And towards the conclusion, I would just like to say that we hope that this webinar shed light on the critical issue of misinformation in the digital era and the importance of trusted sources of information, which many panelists spoke about, whether it's on the internet or even the social media. By emphasizing the importance of accurate information, critical thinking, and effective communication, hope we can all pave the way for a healthier and a more trusted doctor-patient relationship in the digital age. Thank you so much. Bye for now.